Vaagbhata. What do you know or what do you think about Srimad Vaagbhatacharya? Generally, there are two famous statements about Vaagbhata. The most famous statement is Nirukti of the word Vaagbhat. As Charaka stands for he might have travelled to all the lengths of that time Bharatavarsha, from east to west and north to south. So he was always wandering here and there. So Charakaha, Charati iti Charakaha. Sushrutaha, who has listened, who has learned, who has read, who is well trained, well educated. That is Sushrutaha. In the same way, the Vagbhat means Vachi Bhataha, who is expert in Vani, who is expert at word, who is expert in exposition, who is expert in narration, who is expert in vocal presentation or oral presentation or worldly expositions. And the famous one more shloka about Vagbhat is Sutrasthane tu Vagbhataha. The Vagbhat is expert in the Sutrasthan type of subject narration. There are generally 6 or 8 sthanas, parts, divisions of every Sanhita. Sutra, Nidan, Sharir, Viman, Indriya, Kalpa, Siddhi, Chikitsa, in that way. So every Sanhita has Sutra Sthan. Few Sanhitas don't have Indriya Sthan, few Sanhitas don't have Viman Sthan, few Sanhitas don't have Uttar Sthan. But every Sanhita has Sutra Sthan. Out of all the Sanhitas that we know, Vagbhat is best about Sutra Sthana type of narration because he has well arranged it, systematically arranged it. So we praise Vagbhat as Sutra Sthane tu Vagbhataha. Is it so? Is it that much only about Vagbhat that he is best in exposition in the worldly presentation? Or he is best in Sutrasthana only, Sutrasthane tu Vagbhataha? Is it that much? Is it enough? Is it that much limited about Vagbhat? As per my experience, as per my bias, as per my inclination towards Vagbhat, it is not that much only. It is much beyond and above all these limitations. Before I put all the features of Vagbhata's exposition in front of you, let me put some cases. We are in Ayurved education to treat the patient. We are not here to study Sanskrit. We are not here to study history. We are not here to talk about the theories and theorems, and we are not here to discuss about the Siddhantas and Vyakaran and Karaka and Vibhakti. No, these are steps towards the clinical knowledge. So ultimate aim is to relieve the patient from what he is suffering. Correct? The very opening verse, the very opening shloka of Sushruta Samhita says, Sanathan api anatavad vikroshatascha manavan manasinah pidah bhavati tesham hiteshinam. Tesham hiteshinam. The people who are having all the resources, still they are suffering due to diseases. And now they are as good as orphans. Though they have all the resources, all the relationships with them, still due to disease, they are now like orphans. Sanathan api anatavad vikroshatascha. They are crying of their pain. And to relieve their pain, we want to study Ayurveda. So the ultimate aim of Ayurveda is to relieve the pain of the sufferer. Correct? To treat the patient, to give him the health. So here are a few cases I will present in front of you, because though my introduction is given here as I am professor for 21 years and I have received Utkrishta Adhyapaka Puraskar, etc. But basically, when our parents put us in medical course, they expect that you should treat the patient and earn your livings. Correct? So we are basically clinicians. My clinical experience is now running 23 years. So my clinic in Pune and last 13 years in Nashik. Before that I was practicing in Mumbai and Kolhapur also. So the main identity of every Vaidya, every BMS person is clinic, to treat the patients. And then you might be a professor, you might be an author, like that. So first we will go through some cases. This is the first case. First two cases on the single slide. Age 18 days, not 18 years, it is 18 days. It was a premature delivery in 27th week of pregnancy. The birth weight was 980 grams, of course not viable. Abdominal distension was 28 centimeter. The baby was having intestinal bleeding. Oxygen saturation was not maintained. He was supplied with 12 liters of oxygen, hyperbaric oxygen. BPAP was applied. The baby has not passed stool since his birth, almost 10 days. And the condition was septicemia, and the treating neonatologist at that time said that this baby won't be able to see the next morning sun. कल का सूरज ये बच्चा नहीं देखेगा. So that was the critical condition when I visited NICU to examine this baby. What happened to this baby? Is there any description like this in our Samhitas, in Charak, in Sushruta, in Vaagbhata, in Kashyap? Is there any possibility written that the baby delivered before 7th month can be survived? Is it written so? And all the complications that you are reading, is there any description like this available in our Samhitas? So that baby was treated at 1:30 a.m. It is not 1:30 p.m. It was 1:30 a.m. I examined this baby, and the medicines were started at 2:30 a.m. And the neonatologist has already said that the baby will not see next morning sun. And in 4 hours, the baby was out of all the dangers. And at 6:30 a.m., in 4 hours, only 4 hours, the baby was out of all the complications. And today, that baby, which was treated, is at the age of 21 years. This case is treated 21 years ago. So it is possible. It is possible to treat such conditions using Vaagbhata. I practice Vaagbhata. I practice Ayurved. The next case is similar but somewhat more critical. The baby, age 1 day, NICU, meconium aspired during the delivery. Both lungs were almost filled. Opaque, hazy X-ray was there. O2 saturation, of course, not maintained. The baby was on ventilator. All over the chest when we ausculted, the gurgle sounds were there. Doctor declared that maximum 24 hours life expectancy was for that baby girl. Is there anything written like this in our Samhitas? In any of our ancient texts? No. This baby, I was not allowed to treat this baby by any internal medicine. No internal medicine was given. So it was very difficult how to treat this baby. So this baby was treated with external treatment only. I applied only lepas on Ura and Prushtha of this baby girl. We applied 36 lepas in 18 hours and the baby was survived. X-ray after 36 hours was clear, both the lungs were clear. On the X-ray, the date, time, name and hospital name is already printed. And this baby is now today, she is 6 years old. These are two more cases of senior citizens. Age 72 years. When I visited this lady at her home, she was not able to raise her leg. Less than 10 degree was the SLR. MRI report was L1 to S1 all degenerated severely. She was not able to move at all. There was a lot of pain. And severe pain was there, urine motion, everything was on bed. And in 15 days, this lady who was not able to move, who was bedridden for 2 or 3 years, she came on her own feet in my clinic. And after that, till date, in last 2002, 19 years, in 19 years, we have treated such type of 1400 cases. Ligament tear, osteoarthritis, ACL, L1 to S1 degeneration, especially alpha S1 degeneration, sciatica, slip disc and whatnot. One more case is age 60 years, known case of diabetes mellitus. This case was treated in SDM Ayurved College, Shalya department for 3 months because the patient was from Udupi and his hotels were in Pune city. So after 3.5 months, they amputated his two fingers of left leg, and still the wound was not healing. And they advised that you should go for amputation from ankle. But patient was scared, and his hotels were to be managed in Pune city. So he shifted from Udupi to Pune. And my friend there over in Udupi Ayurved College, Dr. Nagaraj, he is my batchmate in Jamnagar. He referred that patient to me in my Pune clinic. I have clinic. I don't have any hospital setup. I don't have any staff. It is a clinic. The patient reached to the clinic and it was very difficult condition. There were so different type of discharges, very foul smell. The total leg was swollen from knee to toe. And it was, how was it possible to treat a patient on OPD basis in clinic who was treated for 3.5 months in surgical department in IPD? So this patient was treated at his home by sending my students to treat that wound, and in 3.5 months the wound was totally healed and it never recurred in lifetime, in that patient's lifetime. Patient died due to heart attack after some years. This case, such 73 cases we have treated. IDDM, the very burning issue nowadays. The first case treated just 7 years ago. This was the presentation, 36 units of insulin. Very high BSL level was there, HbA1c was 10 plus. And within next 6 months, all the reports were normal. There was no protein loss, no weight loss. And this is now a trend that we claim that we can treat diabetes, especially NIDDM, type 2 diabetes, in 3.5 months, that is in 105 days. We can get the reports normal, eliminating all the modern medicine drugs by tapering them out and closing all our tablets which are going for last 3.5 months. Here are few reports. These reports are from 2016. You can see the fasting level 226 and PP level 117, and after 3 months the reports are 74 and 99. Here the HbA1c was 9.4, average sugar was 233, and reports came to normal in 3 months, 6.2 and 131. These are very recent reports, just last month. You can see that 243 to 122, 360 to 177. I know that you are interested in Vaagbhata, the shlokas and sutras and the sandhis. But let me remind that Vaagbhata is not only for Sutrastha. Therefore, I am putting these cases. And from Sutra to Chikitsa, how we use Vaagbhata. Because the audience is not with only students. It is not only with teachers. It is with practitioners also. Okay. See the next report from 360 to 177. This is yesterday's, last Sunday's case. The patient age is 68. The sugar came from 266 to 110, from 313 to 165 within 1 month. His HbA1c from 14, on 14 January it was 14, and on 12 February, last Sunday, it is 11. So in 1 month the HbA1c is down by 3. And this is a diabetic wound patient. Actually the first photograph when he visited, I was not able to find. So these are intermediate photographs. This is almost 3.5 inches long, 1 inch deep diabetic wound. And this was treated in 3.5 months and total wound is healed. So many such cases can be presented with photos and with reports. Why did I presented these reports or these photographs or these cases here? Because Vaagbhata is not about Vachi Bhataha only. Vaagbhata is not about Sutrasthane to Vaagbhataha only. Vaagbhata is much more above and much more beyond Sutrasthan, much more above and much more beyond just words. He is a clinician. He is an anatomist. He is a surgeon. He is instrument developer. He is Vajikaran specialist. He is a Shalaki. He is ophthalmologist. He is Bhuta Vidya Tadnya. Many things. Whatever you name the thing, he is Vaagbhat. Vaagbhat is superior in all these fields. Therefore, for me, Sutra Sthanit Vaagbhataha is a very limited or a very timid description of Vaagbhat. Okay? So, the next thing is where Vaagbhat goes. What is the height of Vaagbhata's expertise? This is a shlok from Vaagbhat Uttar Tantra Adhyay 13, Timira Pratished. श्लोक नंबर 39. कृष्णम सर्प मृतन्यस्य चतुरश्चापि वृश्चिकान् क्षीरकुम्भे त्रिसप्ताहं क्लेदयित्वाथ मंथयेत तत्रस्या नवनीतं यत् पुष्ण्यात् तेन कुक्कुटम् अंधस्तस्य पुरीषेण प्रेक्ष्यते ध्रुवमञ्जनात्. Can you believe that Vaagbhat has written this? This is not from Sushrut. Though this is about Anjana, though this is about Netra, this is not from Sushrut. This is from Vaagbhat. This is from Ashtanga Hridaya. Very difficult kalpa. Take a black snake and take 4 vrishchikas. Add these to milk. Rotten them for 21 days. Then churn it. Obviously, after churning, there will be some butter. Feed a cock with that butter. Of course, due to that poisonous butter, cock will have some loose motions. Collect that all the purish of that cock, and with that poisonous purish, apply that purish to Anjana for a blind person, and then blind person will surely be able to see this world. Praikshate dhruvam anjanat. Pra stands for emphasis. Dhruvam stands for surety. Vaagbhata, who is best in exposition in word statements, who is famous for his brevity, who is famous for his selection of words, he has used 2 emphatical words, praikshate and dhruvam. How much confidence he must have while writing this kalpa. So, are you still of that opinion that Vaagbhat is only about Sutrasthan? No, he is much more beyond and above that. What is Vaagbhat?